larynx, so your superior laryngeal coming in splits into an internal nerve, which goes through the thyrohyoid membrane into the upper part of the larynx above the vocal folds, and the external, which comes down and goes to this little cricothyroid muscle. Meanwhile, the recurrent laryngeal comes up from below, one way or the other, alongside the trachea, and then goes into the larynx from below. So here we've cut away the pharynx, so you can see the recurrent laryngeal coming up, and when it gets into the larynx itself, it splits into an anterior branch, which is going towards the front, and a posterior branch, which is going from the side, and that muscle right there is the posterior cricoretinoid, the one that opens the vocal folds and allows you to breathe. Okay, so what do they do? Okay, the internal laryngeal, that first one that comes in from the top, it's sensory and has some parasympathetics. It goes through that thyrohyoid membrane and supplies sensation to the area above the vocal folds, as well as parasympathetics to the mucosa. Okay, so it's primarily sensory and going to this mucosa. The external laryngeal, the other branch, right, of the superior laryngeal coming down from above, goes only somatic motor. It goes to that one muscle, the cricothyroid, the one we saw on the side, and supplies motor innervation, somatic motor to that. Also throws a few fibers at part of the inferior constrictor. Okay, the big one, the recurrent laryngeal, coming up from below. Okay, once it gets into the larynx, it becomes the inferior laryngeal. It is somatic motor to all of these intrinsic muscles that I showed you pictures of and talked about, except for that cricothyroid, the one on the outside that gets its innervation from the external laryngeal. It's also supplying the mucosa and sensation to everything from the vocal folds inferiorly. So you've got the internal laryngeal doing sensory and parasympathetic above the vocal folds, the inferior laryngeal doing below, external laryngeal doing one little muscle, that cricothyroid, and the rest of the muscles, the intrinsic muscles, are from the inferior laryngeal. So it's a fairly simple breakdown. And they're all ultimately part of the vagus. Okay, vasculature, again, you're all already somewhat familiar with that. Okay. You know this, here's your external carotid, superior thyroid artery comes down, your thyroid glands are sitting about right here, and this big branch comes off the superior laryngeal artery, goes into this thyrohyoid membrane, and then goes inside the laryngeal apparatus with the internal laryngeal nerve. So your superior laryngeal artery follows the internal laryngeal nerve to supply this area up in here. Coming from below, there is an inferior laryngeal artery, okay, that comes up. Again, a branch of the inferior thyroid, right, coming from down below, coming from this thyrocervical trunk, loops across. The inferior thyroid's going to this big thyroid gland lying here, and the inferior laryngeal artery sort of tucks into the larynx. So these guys are just sort of, hangers-on from the thyroid vasculature. And again, there's your inferior, the internal jugular here. There's a superior thyroid vein, which also has a superior laryngeal vein contributing to it. And then there was that middle thyroid vein that's draining blood from the thyroid glands out here, and it has a little branch coming in from here. And then the inferior thyroid vein down there has a little bit of inferior laryngeal vein contributing to it. So all these blood supplies to the thyroid gland have little bits that are also going into the laryngeal apparatus. Okay. Obviously, if you look at the people around you, you will probably find that most of the guys have a real prominent Adam's apple and many of the women do not. And if you look at people of different ages, you might see something similar to that. So in general, the larynx of males is about 40% larger in anterior-posterior dimension from that of females. So, and what you see is the Adam's apple up there is that front part of the thyroid cartilage poking out in the neck. Overall, the male larynx is larger than the female larynx, okay? Which means that the male vocal folds are longer and they're also much thicker. Because they're thicker, they vibrate with a lower frequency, and it gives males a deeper voice. The thyroid lamina forms a slightly different angle, okay? Because it's bigger from front to back, it's a little more pointier, which makes the Adam's apple more prominent. Okay, and you've probably noticed that these changes are not just evident in adults, but the larynx, in addition to being different in males and females, it changes through ontogeny. So babies are born not with an adult-sized larynx, thank heavens, they look pretty dumb. They have a much smaller larynx and it's higher up in the neck. Between 3 and 12 years old, the vocal folds lengthen a bit, so the voice gets a little bit deeper, but it takes place gradually in both sexes. At puberty, testosterone causes the larynx to thicken, the cavity to enlarge, the vocal folds to get thicker, and the prominence to become more obvious, so that after puberty, this is why males sound different and look different than they did before. As you get older, these cartilages, as cartilages are wont to do, they tend to calcify and degenerate. Okay, so that's the larynx. Today you're going to just follow your dissector and dissect it. You probably, most of you perhaps already, made a sagittal section through the larynx so you can see things in cross section. But you want to remove these membranes on the back so that you can see these muscles, and you want to make sure you see the various folds and the vestibule and the ventricle on the inside so that you know what bumps in and what bumps out. The muscles you're responsible for. On the front, you should see that cricothyroid is pretty obvious. On the back side, you should see particularly this posterior cricoretinoid and the nerve going to it. And just above that, these two muscles that are connecting the arytenoid cartilages, the oblique ones and the transverse ones. So in your dissector, that's probably the pages from the old dissector. On C-base, I gave you the sections to avoid in today's dissection. I'll bring them down just in case. But you know, there's 4 or 5 things they tell you to do which don't bother with because they're itty-bitty little muscles, and the chances of you finding them are remarkably thin. Okay, so tomorrow, good luck with your other classes. Friday morning, we will have a lecture upstairs on lymphatics. Oh, wait. I edited that endless movie that we saw last time, which did, like, you know, nose and mouth and larynx and tongue and ears and larynxes. I've cut out the larynx part, so it takes about 30 seconds if it'll actually play. So let's see what happens.
Hacer en el laboratorio hoy, Dr. Gold. Hoy, Dr. Poole, vamos a mirar a la boca, el laringe y la oreja. Bueno, nos vemos en el laboratorio.
Obviously a native speaker. Although Dr. Gold is Argentine. Got to get you in the mood. There's a guest appearance by Dr. Ian George, another postdoc, who slips in unannounced to help with this. fairly easy to identify.
So this enter is not the same one as yesterday?
It's the same one as yesterday, but I've edited out everything except the larynx part. So you don't have to go through the first 4 minutes of struggling with the tongue. Bringing some help. That's Dr. George, the one with the beard. Moving his head very rapidly. Okay. So we cut out the tongue. They're pulling the larynx.
Probably previously cut through.
This is the larynx
Areas.
from the back.
And opened this area up. So just peel off the mucosa off the back here, and you'll find
There you are.
here. Here, the inferior laryngeal nerve.
One coming up below. There's the posterior cricoretinoids.
In the piriformities, that's lateral to the inferior laryngeal nerve, which is back here. And find the internal laryngeal nerve.
Looking inside the larynx. Right there.
Right there. Then you're going to cut open the back of the larynx here to look at the vocal folds. So here is the vestibular fold, the ventricle in between the two folds, and the vocal fold. Alright, there's a few other things you're going to look for. They're mostly muscular, so we'll let you just come
There's
in
the
on your
posterior
own.
cricoretinoids right
And the
there.
last thing you're going to look at today is the middle ear.
We'll
We'll
do
be
that
looking
in a couple of
at
days.
the external ear, but that's simple enough. So
Okay. Okay, so you guys in lab.
Oh, man, did you
Amanda, that's the bag.
Chilling out? Chilling out?
I was having a break. It was like rebar. I met you before that.
You're very observant.
Yeah, that's when I really got the bond with you.
That's how I am.
Yeah.
How do you turn it off? How do I turn it off? Ow. Hit my head. I did. Should I look at
Anyway, I didn't want to get it. Is it on?